Hello everyone. I hope you can hear me well. We are very pleased to welcome you to the 2024 edition of the Data Collection webinar series organized by the Data Collection Unit at UNICEF headquarters. I am Turgay Ünalan, Statistics and Monitoring Specialist, Data Collection Unit, UNICEF headquarters. The 2024 edition of the series focuses on the Multiple Indicator Cluster Survey MICS program, and we will delve into different aspects of MICS implementation at country level, exploring new modules, tools, and features, as well as explore various household survey facets. Webinars will be held about every 2 weeks on Wednesdays from 8 a.m. to 9:30 a.m. EST. Today's webinar is entitled Designing and Implementation of MICS in a Fragile Context, Lessons from the 2022-2023 Afghanistan MICS. Some housekeeping rules before we start. We have scheduled about an hour and 30 minutes today, including questions and answers. Throughout the webinar, please remain muted. Kindly write your questions in the chat box. We will try and group your questions and direct them to the presenters during the question and answers session. This webinar is being recorded and will be available on the UNICEF SharePoint site together with the past webinars. We will also post recordings onto the MICS YouTube channel and so will be publicly available. You can find the links to both of these in the announcement that you received. As I mentioned earlier, today's webinar is entitled Designing and Implementation of MICS in a Fragile Context, Lessons from the 2022-2023 Afghanistan MICS. To facilitate today's presentation, I am handing over to Atilla Hancıoğlu, Data Collection Unit Chief and Global MICS Coordinator. Atilla, please.
Thank you very much, Turgay. Welcome all. Just a few words before we start. We started the webinar series back in September 2020. It was during the COVID pandemic. So far, we have had 34 webinars, all of which are posted on our MICS YouTube channel. We have been covering in these webinars various data collection methods, ranging from phone surveys to data from digital traces, drones, satellite imagery, as well as the more traditional data collection methods like household surveys, censuses, administrative data, and others. And as Turgay has already mentioned, this series, the first series of 2024, will be focusing on MICS specifically. Will go on until June, July, every 2 weeks. This webinar is about the Afghanistan Multiple Indicator Cluster Survey, and let me say a few things about the context of the survey. A very important survey for the MICS program. The survey was conducted 1 year after the current de facto leadership, Taliban, came into power in Afghanistan. When we first started the thinking on conducting the survey, working with the country office of UNICEF, with the regional office of UNICEF, and ourselves in headquarters, of course, we were trying to find out whether it would be feasible, possible to do the survey under the circumstances. We knew that the situation on women and children, in other words, we didn't know that much information about the situation of women and children, and everyone was very curious about that. We were thinking that it had probably drastically changed, but there was no comprehensive survey, nor administrative data or any other source that we could come up with the evidence to this effect. So to fill this massive data gap, as UNICEF, we mobilized our resources to conduct the MICS. My colleagues, Nkandu and Achraf, will explain more. Within 6 months of management approval, the data collection started and was completed within 5 months. And this webinar will share the experience of the Afghanistan Country Office, the South Asia Regional Office of UNICEF, and headquarters of UNICEF in bringing the survey to fruition in a very complex context. You will hear from my two colleagues from UNICEF today, Nkandu Chilombo, who is the Social Policy and Economic Specialist at the Afghanistan Country Office, and Achraf Mohamed Mrabet, who is the Data and Analytics Manager in the Pakistan Country Office. Achraf was, in fact, the Regional MICS Coordinator at the time of the conducting of the survey in the Regional Office for South Asia of UNICEF. We will hear the story of the survey, the interesting circumstances within which it was conducted, and some of the results that came out of the survey. So without further ado, Nkandu, the floor is all yours.
Thank you so much, Attila, and thank you all for joining us today to share our experience. Let me just put up my slides. So, as Attila mentioned, today we share a few insights into the 2023 Afghanistan Multiple Indicator Cluster Survey. My presentation, I'll share it with my colleague, Achraf, and we'll jointly present. We'll basically showcase a few things in terms of the arrangements of the survey, that is the team, the context, the objectives, the design, and challenges and lessons learned. So basically, this MICS was a collective effort of the National Statistical and Information Authority, NSIA, in Afghanistan, the UNICEF Afghanistan Country Office, and the UNICEF Regional South Asia Regional Office, and HQ basically led by the MICS global team. From NSIA side, we had the Field Operations Directorate that was leading the MICS survey. We are very glad that at the time of the start of the survey, the Afghanistan program was the largest globally. So we received quite a lot of attention from both global and regional and country management team. So we were heavily supported. From NSIA side, they were also very keen to have a national survey that reflected the situation with the change of leadership, as they had numerous requests for data after the change of political leadership. As Attila mentioned, in terms of the context, at the start of the survey, that was basically just a year after the fall of the Republic, and a lot had changed in terms of livelihoods in the country, but there was no comprehensive survey to reflect the new situation. Further, there was a lot of concerns in terms of the implication, in terms of service delivery after sanctions were applied on government, and there was massive withdrawal of on budget support. So UNICEF, with our partners, we mobilized ourselves to conduct MICS, whose objective from our end was to inform our humanitarian response, and also just to check on progress of the massive program that we're implementing in the country. At that time also, we wanted to feed into the development of the new UN Sustainable Cooperation Development Framework that was underway. And of course, looking at the richness of mixed data in terms of SDG indicators, we felt that such a survey will be important and also contribute to SDG monitoring. In terms of the design, just to share with you our story, this is basically the first comprehensive survey that had nationwide access in basically almost 4 decades that Afghanistan had mostly had a civil war. Our context still remains complex, but we are proud to say is that comparatively with the previous situation, the security situation had improved. So we were able to have access to households, and we had administered 4 questionnaires, which is basically the household questionnaire, the individual women questionnaire, children 5 to 17 and under 5 children. Those familiar with the mix, you note that only 1 questionnaire, which is for men, was missing. So just a few highlights in terms of the modules that we covered were notable ones were child mortality, immunization, malnutrition at that time was of key interest, and among many other modules that were picked. Further, the education situation at the time of the survey, there were some new policy announcements in terms of suspension of girls' education, but in some provinces that suspension had not taken effect. So we were able to collect indicators both for primary and secondary. In terms of sampling design, the NSIA has a national sampling frame that was developed from high resolution imagery about 2019. It consists of roughly just above 30,000 enumeration areas. NSIA guards this sampling frame quite jealously. So anybody who needs to conduct a survey needs to get authorization, and they are involved in the actual survey to support the sampling design. As for our mix, our sample size was just shy of 24,000 households. We covered 982 clusters. For the 5 big provinces, we had slightly more clusters, about 6 more clusters relative to the other 28 provinces. Compared to the previous mix, this one we had representation at provincial level. The previous mix then in 2011-2012 had regional representation. So this was a step forward for the mix. Just to mention, actually, on the sampling frame, the census for Afghanistan was last done. It should be the only non-census about 1979. So this update was done without link to a census due to the context that we have. As you see from this map, we basically had complete coverage of the entire country. The southern part has relatively fewer dots because most of the south is a desert. And just to mention that before August 2021, a significant portion of the country was not accessible. Some estimate around 40% was not accessible, as it was in control of then the Taliban government, but that is not a scientific measure. So we are pleased to showcase here that our enumerators had full access to the entire country. As Attila mentioned, the planning for the current mix or the recent mix started just before the COVID came in. The plan was to have it about 10 years after the previous one, because in 2015, Afghanistan had the demographic health survey. So there was desire that to make sure that we are able to follow up on certain indicators a couple of years after the DHS as well. Now, unfortunately, COVID came, and in 2020, MICS could not commence. In 2021, consultations again continued with the NSIA, but unfortunately, for almost 4 months after the change of leadership, NSIA was closed, so we could not make any further action on MICS implementation. When NSIA reopened, we renewed this plan. They were also instructed by the leadership to ensure that there was new data available, and actually a new census was even #1 priority, and the household survey was second. But because there were not enough resources for a census, MICS then was prioritized, and we were able to start the implementation in 2022. Just to showcase, there is excellent statistical capacity. The National Statistics and Information Authority, NSIA, and its predecessor, the Central Statistical Office, were able and are able to conduct a regular survey. From 2015, they were able to conduct the demographic health survey, the 2018 Afghanistan health survey, the living conditions survey, and also to mention that the income and expenditure and labor force survey in 2019-2020 was actually fully funded by the government. And this is a rare occurrence in a developing country like Afghanistan. So basically what just misses in terms of statistical product in Afghanistan, it's the census. And this is mostly because of the civil war that Afghanistan has had for almost 4 decades. So the last census was last conducted in 1979. Just quickly to show you in terms of the steps that we took to actualize this survey, we had management approval around February from both NSIA and UNICEF, and we had the survey design workshop in April. In June, we started by having the provincial directors workshop. As some of you may know, Afghanistan is a highly decentralized place, so it was important to have regional buy-in and awareness of the provincial leadership on the objectives of the survey. Between June and August, we were able to conduct the survey, and the main training continued slightly into September, and data collection started end of September until end of February. Suffice to mention is that we had a suspension for almost a month during this period. And within a month, we were able to finalize the summary finding report, which underwent internal validation and clearance, and was disseminated by both UNICEF and NSIA on 6th June. NSIA actually had even translated the Pashto and Dari version. So this is quite a comprehensive timeline. In terms of the budget, just to report that the survey just costed shy of $4 million. As you know, our context is quite difficult, and to put up such a massive survey, it didn't come cheap. In terms of funding, this survey was funded by UNICEF and the World Bank through the Afghanistan Reconstruction Trust Fund. We are grateful to the World Bank for this contribution and their partnership and commitment to support national statistical systems globally. This did not come at all easy. We had many challenges, and just to share with you a few, as you may know, the political leadership in Afghanistan is not recognized. So even from the UN point of view, we could not sign a joint agreement, as is normally a standard in MICS. And therefore, we were only able to activate our partnership through an exchange of letters, through a letter of intent. And we are glad that NSIA was flexible and trusted us to proceed this way. In terms of female enumerators, who are the majority for data collection in Afghanistan, it is a rule here that when female leave the household, they need to be accompanied by male relatives. And for us, this was an added burden on the budget for the survey, as we had to factor it in into the budget, and that resulted in increased cost. During the course of the survey, there was a restriction on employment of females in the NGO sector, and some local leadership felt that our data collectors were not authorized to do work on behalf of UNICEF and NSIA. So on 3 occasions, we were actually stopped in 3 provinces from data collection, but we are happy to report that in a matter of days, this issue was resolved by the NSIA provincial directors. Afghanistan is a mountainous place and has a harsh winter. At the moment, our lowest temperature actually this week is around -15. So this is quite harsh, and it was quite hectic even for our team. But in terms of planning, we started with had to reach areas to ensure that we had collected data in these areas before they became inaccessible during winter. One of the challenges, big challenges that we faced was interministerial coordination was weak. It was a new government, and the leadership is basically a coalition government, and to organize a steering committee was a challenge. Therefore, interministerial coordination was weak at government level. However, UNICEF technical teams and NSIA had coordination meetings almost on a weekly basis. For challenges, further challenges, I pass on to my colleague. Over to you.
Thank you so much, Nkandu. I hope that I'm audible.
Yes, you are.
Okay, great. Thank you so much. So through this slide, we're going to walk you through the challenges that we faced in this mix. And those challenges are going to cover the design, technical part of the design, the data collection, and the post-data collection till the dissemination of the results. So we start by the design. When we talk about the design, we talk about the sampling plus the questionnaire or the content that you're going to collect. So for the sampling design, the first challenge that we face is the absence of the census, which in 98%, 99% of mixed surveys, we are using the census as sampling frame. In some cases, we are using master sample. But in the case of Afghanistan, the recent census is 1979, so it was not possible to use that census as a sampling frame. Working with NSIA, the plan A that they have is to use this satellite imagery. It's 2019. But we wanted to seize this opportunity as well in the mix in Afghanistan to explore the possibility to use the grid sampling. So we made initial discussions with some experts on that, with the NSIA, with us as technical team. But we didn't go ahead with that for two main reasons. First of all, the limited time that we have. This is another constraint that it's overall maybe technical and non-technical, that we had to rush and collect the data as soon as possible and finish the design as soon as possible. So we had to have enough time to have that, to mature the idea with the NSIA, so we'll be able to buy in and we move ahead with the grid sampling. So we used the imagery satellite as a sampling frame. NSIA used that as well to implement, like Nkandu has mentioned, the income expenditure survey. So it's also already has been piloted and tested. So this is number one. The second thing is general, but in Afghanistan was a huge. We received a huge demand to include information to be collected through this mix. A huge demand for different stakeholders. We managed this by two steps. We created kind of criteria. This is one. If this model is going to be included because of 1, 2, 3, 4 criteria that we set at the beginning. The second thing, which is more critical, we set up a rule for us as a technical team. We said, evidence shows that if you go with a huge and heavy questionnaire, you're going to maximize the likelihood to have low quality data. So we said, let's make this questionnaire as lean as possible. So this is the general guidance plus the criteria, and we come up with this content, but the consultation has taken some time, and sometimes it was very difficult to drop a module that we feel that it's needed, but because of the criteria, because of the general guidance, we were not able to include it. The third point is the training. Well, the plan A, again, And you're going to hear me talking about Plan A and Plan B, and this is how we manage this survey. Honestly, we tolerate this uncertainty. We walk with uncertainty. We try to manage, to stop, to pause, and also think how to manage any difficulty that we face. So the Plan A was to create for the training, since we have more than 150 field staff in this survey, to create 5 or 6 training rooms with a very strong mixed consultant having the language, Pashto and Dari, and be able to train the field staff at the same time, having in the afternoon some debriefing to harmonize the information. But the language was a barrier. It was for us almost impossible to find these 6 profiles. Very good, stronger facilitator of training, plus Pashto and Dari language in their pockets. So we opted out for this, and we come back to the decentralized training. So we opted for the TOT, and TOT is very well known with the cons that it's very difficult to make sure that you have unique information passing from the trainer to the enumerator. So we manage this as well. The fourth thing is about the fieldwork monitoring. In our system, the MICS guidelines, we need to go to the field. We need to go to observe the interviews. We need to have female interviews to be able to manage the observation of the enumerator. So it was difficult for us, challenging, because of the situation. Whenever we plan to go to the field and try to zoom on certain performance of teams in the field, we received an alert. You should not go to that place. You should not go to that area for the moment. You need to pause. So this is something that we really faced. In other usual contexts, it's easy to do that, but in Afghanistan, it was not easy. The first point is about collecting the geocode, and as MICS team, it was very important for us to collect the geocodes in order to use it for analytics later on. It was not possible. We started by, then we stopped for certain security concern raised by some provincial directors in certain provinces. The fourth point, or the fifth point, is about reporting on age and date of birth, and also low birth certificate non-availability of this coverage. For the reporting on age and date of birth, it was very challenging. And you know, as a household surveys, all the denominators requiring to have accurate and precise reportings on age and date of birth. So it was also challenging for us. We had to manage this as well. The last point is on the validation of the results. It was the first comprehensive household survey centered around children. The last MICS was conducted in 2011 and 12, so 10 years ago. We have the last MICS. The DHS was conducted 2015, 16, and unfortunately with a limited representativity for the southern provinces. So it was difficult as well to compare the global indicators from the MICS, what we got from the MICS with the DHS. So it was a bit constrained to make that validation. What we used on that, we had internal consultation with expert thematic. We had the consultation, we presented the result, and we say to them to what extent these results are expected from your side. This was one option that we used. The second option was also to look around Afghanistan. What is the country that could be similar in terms of the context? So we found certain provincial mix in Afghanistan, in certain provinces like KP, and we tried also to benchmark and to see the trends and to compare where we are in terms of Afghanistan comparing to the other mix, provincial mix. The last thing on the validation, it's unfortunately that we found ourselves as well with some conflicting numbers between the mix and the SMART survey. So we found significant difference in SMART between SMART and mix, but at the end we found an explanation for that, and we've been able to explain that mainly is about the fact that we conducted the mix almost 3/4 of the field work or took place during the winter, and through the data analysis that we've done, we come up with a conclusion or with the finding that a huge proportion of children were undressed while we did the measurement. So this was an explanation for these differences. We learned from it. And also as a lesson learned for us, we should not conduct a mix and smart at the same year. Nkandu, I think I'm done with this technical analysis, so over to you. Thank you.
Yeah, thank you so much. Just building on the lessons learned about not doing smart and mix at the same time. One other challenge that we faced, one other lesson that we learned from this survey was to ensure regional and community buy-in. So households in Afghanistan are more comfortable to be interviewed by people who come from that region. So the accent or the way you speak, they're able to know that you come from a different region, and acceptability is a challenge. So we ensured to have regional-based teams to do our data collection. Second, as we have shared earlier, was agility or flexibility on the part of NSIA to be able to give UNICEF the responsibility of day-to-day survey administration due to the restrictions that were there on the part of government in terms of flow of funds. This was a unique case in Afghanistan, as mostly our NSOs does this component. One other thing that we felt and was important to retain was to keep NSIA leadership in the sampling design. There were options at the time, especially in the planning stage when NSIA was closed, to have alternative sampling frame for mix. But in the end, NSIA opened and we retained that leadership to use the national sampling frame and ensure comparability even to the previous mix. Yes, again, building up on the earlier component on anthropometry measurement, we were doing mix almost at the same time with the SMART survey. So we benefited in terms of capacity to ensure quality. We basically used the SMART certified trainers. Also in mix to ensure consistency, and also we spent a little bit more time on anthropometry measurement in terms of training and also monitoring. Internet is a challenge in Afghanistan. Our initial desire was to ensure that teams were able to sync in data at the end of the day so that we could be, through our real-time monitoring system, would be able to monitor the quality of the data, and if there's any cases that were flagged, would immediately address. So we invested in quite comprehensive real-time monitoring, and during the initial investment was more to recognizing that there will be security challenges, so we may not be able to access teams as frequently as we were able to. But the lessons learned here was that actually the real-time monitoring system was complementary to the fieldwork because we were lucky that NSIA had lesser stringent security requirement to go to the field. So the real-time monitoring system was feeding into their monitoring, and they prioritized more teams that had flagged cases in the previous week, and issues that emanated from those reports were addressed immediately. Like I said earlier, data is a political issue, and there was sensitivity around the purpose of MICS. Some stakeholders initially felt that maybe this was an assessment of the situation of women and children on the new leadership. And we had to, from the beginning, clear that with the regional directors workshop, that actually the situation of women and children, these are outcome or even impact level indicators which do not change in a period of a year. And therefore, whatever findings will come out of this survey cannot be used against the leadership. And for UNICEF and partners, this survey was more to support evidence-based humanitarian interventions. Just this is a product from our real-time monitoring system, and my colleague Achraf can come back now just to shed a little bit more detail on these charts.
Thank you, Nkandu. On that, it was very difficult for us to go to the field, but we felt that we need to strengthen the real-time monitoring, the virtual real-time monitoring, to be able to have a look at the data as soon as collected. So we'll be able to send the feedback from our side to the teams in the field to be able to rectify, to correct, to come back to the household while they are in the cluster or the enumeration area where they are working. So what you see now is a snapshot of graphs that shows the performance of the teams. It's on your left. And this is analysis that used now by the global mix team to make sure or to understand or to explore to what extent the team is doing in the field work. So we just try to select certain variables, and we try to also look at the performance of interviews against these variables. Can we go to the next? This is the second slide that we showed you on the real-time monitoring system. This is based on the data collection. So we've been able to generate tables of the data quality in the real time. So end of the day, we'll be able to have these tables and this graph to show, for example, the completeness of the households interviews, the women interviews. Also, we have certain statistics or data quality on the timestamps. So how long the average, the duration in average of interviewing. So if we feel that it's shorter than the average, we need to come back and bring feedback to the teams. We did this dashboard, and now it's integrated on the standard MICS tool. So MICS in Afghanistan was also an opportunity to have that type of dashboard to be able to complement what we have in the MICS from the beginning. So over to you, Nkandu.
Yeah, so at the end of it all, we have taken through about the story, and now we just felt it's necessary to share with you some of the findings. The reports are publicly available, and some of you might already have seen this. But in summary, one of the key things that this mix has really confirmed is the regional disparities. And there is basically two worlds in the same country. If we look at, for instance, under 5 child mortality, a child born in Nuristan is 8 times more likely going to die before their first birthday compared to a child in Kapisa. So this is the reflection for us, especially as we design our programs to look at these regional disparities. One of also the key finding that was quite eye-opening for education was that despite the policy allowing both girls and boys going to primary school. Only about half the children were attending primary school. And for UNICEF, this was a big realization. Because mostly we look at policy hindrances to access, but in this case, it just shows that there are other barriers in terms of access to education in our context. Stunting and wasting were quite elevated, and although MICS had slightly lower, had lower numbers for wasting compared to SMART, but still the results were relatively high. Child labor was also on a high note. One of the key reflection is that even for those who were in school, they engaged significantly, spent a lot of time engaged in child labor in Afghanistan. Basic sanitation is an issue. About almost 26% of households engaged in open defecation, and this came to light in our finding. At the end of the day, we see quite a significant correlation of these indicators to women's education and poverty. And going forward, we need to do more in-depth analysis on this. But at the end of the day, in summary, this is what we can say for now. Thank you so much. This is the link to the report, and I hand back to Attila for the next steps. Thank you.
Thank you, Nkandu, and thank you very much, Achraf. Fascinating, of course. Many of the challenges that you mentioned probably apply to other countries too, but Afghanistan is a very specific context, so not at all surprising. I'm sure I'm talking on behalf of the audience here. Not surprising to hear that many challenges and also lessons learned. Now we have a number of questions in the chat box that have come through. Several of the questions I can group into one, I think, which all have to do with the quality of the survey in some way. How was it possible to? What do we do in terms of managing the data quality, in terms of supervising the field, especially in areas which were tough, which were difficult to reach. Then questions on how did we safeguard the confidentiality and privacy of respondents in the face of this context. And together with this, of course, maybe something related, of course, does the survey represent the diversity, the socioeconomic and ethnic diversity of the country? And maybe I should add in, because they're all related to the quality of the representation of the survey in a way, I can maybe add in the issue of males having to accompany interviewers to go to the households. What effect would that have on the quality of the survey? And then we have a number of questions which are sampling related, but let me stop there and listen to you on your answers, and we can go into a next set of questions. Over to you, Nkandu and Achraf.
Okay, so maybe let me start. One of the things we are really grateful is that NSIA has remained quite independent from political interference in terms of their operations. So we still have a good technical team. The impact of brain drain on NSIA was very minimal. So there's still a solid team. So we can safely say that we had a team that collected data that was not influenced by any political or any other force that was there. Then secondly, also maybe it didn't come out much in the presentation, is that the enumerators are basically, there is a national pool of data collectors who mostly fall on to hire during surveys. So these were the kind of team that we had. Then coming back to us during the survey, we had this two-stage system of the real-time monitoring that was flagging cases, and on a daily basis through WhatsApp feeding to the team. Then again, also feeding to the NSIA team that was able to access the field team. So NSIA, Central NSIA in Kabul, was able to do field monitoring and provide technical support and check on the team. Further, we had the smart certified trainers who are not from NSIA. They are basically from the Ministry of Public Health, who also did monitoring with a focus on anthropometry measurement. So basically that is more to assure on the quality. Then in terms of male accompanying, we had actually one of the positives is that to minimize, and this came from our colleagues from NSIA, is where possible we recruited couples. So there was already a very good chemistry and relationship in the teams. So in certain cases we had the supervisor and maybe the wife, at least within the team, all of them, so there was not really like someone watching over the other. That's one. Then during data collection also, because of cultural context, is that the female interviews are done separately from male. So it's not really like the male who accompanied the female witnessed or were present during the interview. They were basically seated away from the actual interview. I think for now, that would be my quick feedback. Achraf, over to you.
Thank you so much. No, I would like to add something on the data quality. There is no household survey that there is no problem or issues on data quality. This is something that we need to agree on as people working or interested in household surveys. But for us, what we wanted to show through this presentation that we put a system. We used what we have as resources, given the constraint and the situation of the country. We try to optimize this partnership and NSI as much as we can. For themselves, they've been able to deploy female quality responsible of the data. They were there on the TOT. They were the ones participating on the TOT. We used this dashboard that's been able to manage to look at any discrepancies that could come from the field. We managed to look at the performance of the interviews. We managed also to look at the trends of certain variables, data analysis. We did some data analysis and we digged more and more on the data analysis while we're still on the fieldwork to try to understand whether there is a pattern of certain data cooking or fabricating, but we didn't find that. And this is something that we admit. We, in our mind, going to the field in Afghanistan, it was very challenging. We put the worst case scenario and we worked for that worst case scenario. This is what I can add, Attila and Nkandu, on that.
Thank you very much, Achraf. Good points. But I should just add from my side also that Afghanistan is a very specific context, and as you pointed out, on one hand, there's no household survey which is completely free of data quality problems. There will be some data quality issues here and there. The art here is to keep them to a minimum and avoid data cooking. Data cooking doesn't happen in household surveys as much as we think in the media. That's a myth, more or less. Data cooking happens less. The bigger problem in household surveys is when you have poor training of interviewers, poor supervision of the field, so things get confused. Questions are not asked properly. Questions are asked too fast. Results are not coded properly, etc. But Afghanistan has had additional circumstances, of course, which made it even more challenging. Now I will try to go from the top of the chat box and see those questions which would be interesting to tackle. The first one that came in was about the criteria that was used for deciding about the contents of the survey. And would it be possible, the question was saying, to share the criteria you used? In other words, how did you decide about the content of the survey?
I can come in, and Nkandu, you can complement, please. I think it's a very relevant question, very pertinent and relevant questions. For us, the criteria was out of 3 or 4 criteria. The first one was the need to, we do not consider a model or information that we have some recent data. So if something has been collected through the recent household survey by NSI in Afghanistan, we're not going to include it, especially with these impact indicators or long outcome indicators. And I can mention an example on the water quality testing. The model has been implemented in 2019 on the income expenditure survey. So we thought that it's not now time to collect data on that. And we will be able to collect data in next opportunity. The second thing is we also try to avoid any sensitive models, because for us, if we include any sensitive models, this is going to raise eyebrows, and this is going to affect or disrupt the entire data collection for this mix. The third criteria, if this is what I have on top of my mind, is related to the work that UNICEF is doing. So very, very critical for us to include something related to the programs that we are doing. This is what I have in the top of my mind. I don't know, Nkandu, if you can add, since you were on the heart of the consultation on the content.
Yeah, I think you are right, Achraf. There was certain modules that were deemed sensitive, and because of that, we could not include them. But also focus was more on through our consultation, UNICEF and stakeholders, in terms of what relevant indicators they needed, so that at least we'll be able to respond and collect information in a period that was timely. Because if we made the questionnaire a bit heavy, we would have spent a little bit more time in the field, and of course that would have affected quality. So it was sector level consultation, backstopping also with the NSIA in terms of consultation.
Thank you both. Let's move on then. Some sampling related questions. Maybe I can also complement. It came up during the timeline slide, of course. But first, you mentioned, Nkandu, that there was an estimates of enumeration area sizes, the number of households through satellite imagery in 2019. Then in the timetable, you actually showed that there was a listing operation. I just wanted to highlight that on your behalf, having been involved in the survey too, that there was a listing operation that where we updated the number of households in each of the selected enumeration areas. So the sample was updated as of the time of the survey. The listing operation was conducted very just a few months before the actual data collection. There was a question on the sampling strategy, although some of it was mentioned. What were the strata? I would like to give you the chance to reiterate it. What was the strata? What was the frame that was used, and also does again the sample reflect the diversity of the Afghanistan population, and if so, how? And I should also point out from the top of my mind that as far as I know, the MICS in Afghanistan was the very first survey for a number of years which was able to access every single part of the country. So there was 100% access to every province in the country. Maybe you can say a few things more about the sampling strategy and how it was organized.
Achraf, you want to go?
Yes.
First?
Yes. And then I will give the floor, Nkandu, to speak about the context and accessibility for the first time to the fieldwork. I mean, for the sampling design, what we choose, and there were also discussion. And thank you so much for raising this question, because it reminded us, all people who were involved, with the long discussion about the level of representativity of this mix. Whether are we going to go only at the national level and estimate the national, or estimate at the national level for Afghanistan, or are we going to go a bit deeper at the area of residence, meaning urban, rural, or are we going to estimate or provide estimate at the level of region? Region is the cumul of certain provinces. And then the decision was made, and I think it was very wise decision and very wise move from our side to keep the level of representativity at the provincial level, meaning 34 provincial level, urban, rural, plus the national one. This was the level of representativity that we aimed for. If we have the chance to look at the report, and you can see also the confidence interval for this for this certain domain of estimation, you will find that you have in most cases precise and very confident intervals for the indicators. The map that we showed shows exactly to what extent this the sample was spread out the entire country. I think, Nkandu, you can add on the accessibility and what DHS presented, the demographic health survey, and the constraint that we didn't have it, fortunately, in this mix.
Yeah, no, thank you so much, Achraf, for that. So basically, our survey was quite comprehensive, and there was no part of Afghanistan that wasn't covered. So in terms of diversity of the population, that I think we are proud that we had full access. Maybe just to, I think my colleague Atal should be in. I think he can also, he has quite a lot of insight. He was even involved in the other surveys before as regards to sampling. Anything to add, Atal?
Possibly not. Maybe we can move on that one. But again, just to emphasize that accessibility was very, very good in the survey. A couple of other questions. One question. Well, maybe I can go back to a couple of questions about geocoding and satellite imagery. The satellite imagery in the survey was used only in terms of the sample design, because there was a satellite imagery in 2019 which estimated the sizes of the enumeration areas, and that was we did make use of that for the sample design and selection, or initial selection of the enumeration areas. Then it was, of course, updated and listed, as I mentioned. For the geocoding, maybe you can say something about geocoding, Nkandu?
Yeah, thank you so much, Attila. Yes, so initially there was desire to collect GPS coordinates from both NSIA and UNICEF for further analysis. But while data collection was underway, there were sensitivity by some regional leadership in terms of what that could be used for, and they raised concerns. So to ensure security of the team, that was stopped while the survey was underway. But at least there was desire from NSIA as well. But just to protect the team, that was stopped.
Thank you, Nkandu. So one question. I'm fascinated regarding what you say about male relatives having to accompany female enumerators, and that this significantly increased the cost of conducting the MICS survey. Can you estimate how much this additional cost amounted to? And this would be a good way, the colleague is saying, this would be a good way to indicate the economic cost of gender inequality.
Okay, that's quite interesting.
It's an interesting
yeah, it is. It's something that we can look at in terms of the field teams we had, how many had Marams, and how many had couples. We had some savings where we were able to get couples. So what it entailed for us is that, for argument's sake, in the team of 6, 4 are female. And if you don't have any couples, it will mean, and these 4 are coming from different households, they are not related, then you'll have 4 male accompanying them in the field work. So meaning you need to facilitate transport because these field teams covered the entire province. So that to increase the transport cost and also increase the allowance because they had male relatives that had to accompany them. But we can say is that to a relatively good proportion, we had some savings when we managed to get couples to be part of the team.
Thank you, Nkandu. In response to one question that I'm seeing in the chat box, the survey did not include health expenditures. That's something that is not part of the mix normally. But there's another question which is still related to female interviewers. Do you know if the requirement for mahrams for female enumerators had a big difference on interviewer effects for more sensitive survey questions than the women's questionnaire?
Okay, so I think from our survey implementation point of view, that didn't have any effect because in Afghanistan culture, when you are doing data collection, you are doing interviews with female, the male stay away. So it's not really like the male accompaniment, male accompanying the female enumerator was doing interview in the presence. No. So what will happen is those that will escort the enumerators were mostly standing at the gate, and the females will enter the household and do the interviews in the household. So they were not in close proximity to the actual interview. So that effect, I would say from the monitoring that we did and what we saw, I would put it at almost zero or negligible.
Thank you, Nkandu. In fact, I can add that there's stories in the literature indicating that in some surveys in Afghanistan, male household heads or males of the households were not letting interviewers come into the household because, I would say, because of poor planning and poor forecasting on what the challenges would be. But in our case, in the case of Afghanistan MICS, this did not come up as a problem at all. Okay, about the seasonality of findings, the survey went on for 4 or 5 months, right, for data collection. What would you say about the seasonality? Would the results be seasonally biased due to changes based on seasons in a food security situation, for instance?
Can I come in on this? I think it's another great question from the colleague. We believe that certain indicators has been affected by the seasonality. We already mentioned the wasting indicator. We didn't collect information on the food and security, and the model of food and security as a topic was also at the table, very much at the table. Nkandu, you remember, while we consulted on the content, but at the end we dropped that model. But for that, I think we need to dig more on the data, and also maybe in the next opportunity of MICS, we'll be able to manage and to assess the impact of seasonality on certain indicators. But the literature saying that for certain indicators is for sure certain indicators seasonality has an impact on certain indicators, and we already mentioned the wasting. Over back to you.
Maybe
please,
just to add, one of the experiences when we were trying to explore the possible differences between the SMART survey that was done during the lean season, which is basically at the peak of food insecurity, and our MICS, which was mostly done through winter. One of the insights that came from our nutrition colleague was that because it's winter, you are more likely going to have mothers stay home, so there will be more breastfeeding, and you are more likely going to impact on an indicator like wasting, which is very sensitive to seasonality. But I think this is a matter that we need to dig a little bit more, but these were the sentiments that were coming, for instance, as regards to breastfeeding having an immediate impact on the weight of the child. But more further work will be needed on that.
Well, for sure, for cross-sectional surveys that use a protocol of visiting households only once, that go on for a limited period of time, some indicators are going to be slightly affected by seasonality. Of course, when school participation is high and you're doing the survey during school months, for instance, you are going to have a slight seasonal bias in child labor, for instance, in some countries, just to give an example. But we know these indicators. There's abundant literature on these. So when we collect data on such indicators during certain seasons in certain countries, we do know that some results will have to be at the lower end of what is actually the case on an average during a year in a country, and which ones are going to be higher. What ethical protocols were obtained and from whom in the survey, considering the children were part of the survey? Well, children were, okay, I'll let you answer that. I'm tempted to answer some of the questions because I know the answers, but it's important that we hear from you, Achraf and Nkandu.
Nkandu, you can take it, then I can complement.
Yeah, so, okay, basically one, in terms of ethical clearance for Afghanistan, NSIA has an internal ethical system. So that was from NSIA side of it. For UNICEF, we also have our own protocols that were enforced during training, and mostly they were, I would say, Achraf will come in terms of interviews based on children, that were more on the Guardian as opposed to actual interviews on children specific. Over to you, Achraf.
Thank you, Nkandu. Maybe two main things related to the confidentiality. What we do in MICS is that we collect the data from household through a consent. So we don't collect any single information before getting the consent. And with the consent, we are reminding the respondent that all what he's going or she's going to say will be remaining or will remain anonymous, confidential. This is number one. And once we get the consent, we move ahead to collect information. This is one. Two, you go to the website now, micsunicef.org, you browse, you will find the report, you will find the data sets. And what you find in the data sets is anonymized data sets. So this is something that we also try to be consistent in this. We anonymize the data set before sharing on the public domain. These are the two things. First, we don't collect without consent. Second, when we publish the data sets are anonymized. Attila, if you have something, you can add as well.
Not at this moment, but thank you very much for the responses. I'm going to be a little bit more selective about the questions now because we are coming to the end of the time allocated for this. Well, there's a lot of praise as well in the chat box. I'm asking questions all the time, but there's a lot of praises about the monitoring system, the data quality assurance system that we have put in place, and specifically about being able to complete the survey in a difficult context in Afghanistan. There's an interesting question on how did you deal with the definition of resident of the household, particularly in areas where there's a lot of displaced population?
Okay, I can take it if you want. Nkandu, or you want it? Take
Please. Go ahead.
No, what I can say on that, it's also a very great question or a great question. In MICS in this household survey, since we are working with the government and the NSI is implementing this survey, we use the same definition of the households. This is what we are using. So if they consider a member of household somebody who is here for the 6 months, the actual 6 months, so he's member of the household. If there is a different definition, and we are using this approach to be able to compare across the mix in the countries that we are implementing the mix. So we used this method, this definition on considering who is member of the households. Displacement, it's not covered as a topic in this mix. Usually we consider, and this is maybe the limitation of the household surveys, we are considering only the households. We are approaching structures, and on the structure we found the households. So this is what I can add on this. I don't know, Attila maybe or Nkandu want to add something on this.
Nkandu?
Yeah, no, just to say is that one is that yes, we, in terms of households, mostly we went for structures, and Afghanistan by nature has a relatively high household size. So from our own experience and during the field implementation, we didn't, at least we didn't get any feedback of even during listing that certain households were missing because of any displacement. So I think we basically went with a definition as per national standards, and but relatively Afghanistan has huge families living together.
Plus, of course, the fact that we did listing updating of the sample frame very close to the actual data collection, we are able to, because there's a question about that too, we are able to cover for those who have been displaced and have moved to other places. But of course, the survey would not represent those populations who have fled the country during the troubled times. But it is on the basis of this updated sample frame that we are able to correctly and accurately calculate sample weights and make the survey as representative as possible. Just to confirm that questionnaires were translated into both Pashto and Dari, right?
Yes, they were translated. Yeah.
Okay. Good. I'm checking the chat box. If you have any other questions that you would like to answer to, I know you have been canvassing the chat box as well, Nkandu and Achraf, to make my life easy, because there's a lot of questions.
Yeah, there's one question, Attila, where was SMART done at the same time as MICS? The answer is no. The SMART survey was done before MICS. They did data collection between April and July, mostly, and we did our data collection end of September to February. So our period didn't cross.
Okay. There was a question about the differences between MICS and DHS. Maybe that's a very general question that has been addressed in many other webinars, but just to say that there are similarities in terms of the methodology of both survey programs when it comes to sampling. The content, there's probably a 60% overlap between the two. MICS is a very child-centric survey program. So the core of the MICS as a household survey is children. Some questions are coming, or some requests are coming to share the documents, the slides. As I mentioned earlier, this presentation is going to be on our MICS YouTube channel, so you can actually go to the MICS YouTube channel in a few days' time and have access to all the slides through the recorded presentation itself. Okay. I think that's more or less it that I see. I'm sure there are some questions that we have not been able to answer to the full satisfaction of everyone. That's the way it goes with limited time. Okay, there's a question about from Bangladesh, I think, about blood lead levels. I want to mention that Bangladesh MICS is going to be including a module on testing blood lead levels in children. We didn't have it in Afghanistan. That's a new thing. Guidelines are being developed as we speak. This is going to be the second survey after Georgia for some years ago that will include this module, and we're looking forward to that. Okay then. Thank you very much for the excellent presentation. Nkandu and Achraf, many thanks for joining us today and presenting on this. Fascinating, certainly, as you can all say, of course. Thank you, everyone, for your participation and for the great questions and the comments. The questions were really good. Thank you so much for the next webinar. In the series is going to be on the 21st of February, in 2 weeks' time. It's going to be an introduction to IPOMS, which is a project of the University of Minnesota, and the harmonization of UNICEF MICS data. We have been having a partnership with IPOMS. That's going to be exciting because it's going to be explaining how accessibility of the MICS data in a harmonized manner is going to be greatly increased through this project, which is underway. which is actually implemented right now. As I mentioned earlier, the recordings will be available of all these webinars on the internal UNICEF SharePoint, but also on the MICS YouTube channel. So I'm looking forward to your participation in the forthcoming webinars. And once again, thank you very much, Nkandu and Achraf, for today's presentation and webinar. Take care,
Thank you
everyone.
so
Bye-bye.
much.
See you next.
Thank you. Bye.
Thank you so much. Bye.